Good morning and welcome to COVID-19 Talk with Local Health Authorities. With me is Dr. Janita White representing Harris County, Dr. David Pearce representing the City of Houston. Special thanks to past President Kathy Fenninger, Rotary Club of Houston, and our producer, Morgan Ash. I'm Stephen Williams, Director of the Houston Health Department. Okay, a lot of things have been going on with COVID, as we've been saying for the last few weeks. We know that numbers are high, and there's some questions related to this. First one's on testing, though. If COVID is suspected in my child's class, but confirmation is pending, what should the other students do who were in close contact with that child? I'm sure everybody wants to hear the answer to that, Doc.
It's a challenging question to that. It's a challenging answer to that question. On several considerations. So to that person, one thought though is your health departments are great resources, both City of Houston and Harris County Public Health. If you have unique questions, we definitely have teams that can take your question. Reason I say that is because it does matter if your child is under the age of 12 or older or over the age of 12 and or has received a vaccine. It also matters if where they're doing their learning, masks are being worn or not, and or if your child also has other health issues, weakened immune system. And so there's so many unique concerns about that question. But on average, when a child is around a close contact, quarantine is usually about 14 days, and you're waiting for that information of the known positive that your child was around. You have that time to basically do your quarantine. So a lot of schools are using that 14-day timeline of quarantine. So that's a general answer, but it can be very much more unique depending on your particular situation.
So the main point is that your health departments are there to be a resource to really help you figure this out.
Absolutely, because again, there's so many algorithms to consider. And like I mentioned, if you're vaccinated, if you're not, children under 12 can't be, mask or not, and if your child may have an immune situation which weakens their immune system, there may be considerations about how long they would actually have to be quarantined.
Have heard many times that when you get a positive test, you're contagious regardless of symptoms. What about those who test positive for longer than 10 days and never had symptoms? When can you safely believe you're not contagious?
And when you first test positive and the PCR is the more sensitive of the test when you compare it with the rapid test. When you test positive, you are contagious. In fact, what we know is that for most people, and the question goes to those who don't have symptoms, but most people who have symptoms, they were contagious 2 days before they had symptoms. So when you consider that most people wait until they have symptoms before they get tested, they were absolutely contagious when they tested positive. Now, the CDC rule for when you're no longer contagious really doesn't to do anything with testing. So it's 10 days. At the end of 10 days, you should be fever-free for 24 hours at least, and all of your other symptoms should be improving. Now, if you're not fever-free or if your other symptoms are not improving, you are still potentially infectious to others. The problem with continued testing is that there's this phenomenon that's been called viral debris, where you may continue to test positive even long after the illness, because there may be some viral debris in the nasopharynx that the test will pick up on. It's sensitive. So this is why the CDC moved away from testing out negative or waiting until you test negative, but really it's that 10-day rule, no fever for 24 hours and all other symptoms resolving, or if at 10 days you got to wait till you're fever-free and all your other symptoms are resolving.
At the time you receive a positive PCR test, are you always contagious? I think you just answered that.
Yep.
Yeah. The UK was decreasing, but now it's going back up. What is TMC showing?
TMC, it's interesting. So the TMC data overall, it shows that there is a little bit of a decrease in the number of new daily admissions. It's not a huge decrease. It's a little bit of a decrease. But when we look at hospital systems within that, what we're finding is that Harris Health, for example, they're not seeing a decrease at all, none whatsoever. Their numbers continue to go up. Some of the other hospital systems are reporting a flattening, and a couple are reporting that the numbers appear to be going down. And so while overall we have a flattening or perhaps a little bit of a decrease within the TMC. I think what we're seeing now is that within different patient populations, because different hospital systems sort of appeal to different patients, right? So Harris Health appeals predominantly to the uninsured and those that are on the Harris Health plan, whereas Methodist, Memorial Hermann, St. Luke's, they appeal to different insurance plans, which then have different patient populations. And so what we're seeing now is a little bit of a separation or a change in the viral behavior amongst patient populations. Apparently, at this point, it looks like it may be going along economic lines, which is a really sad comment.
Yeah, I was going to mention that pretty much follows what we're seeing from a geographical perspective, because in some zip codes the vaccination rates is very high, and other geographical areas the vaccination rate is low, and so it really probably holds true that those individuals that are in those neighborhoods with low vaccination rates are liable to be more susceptible to COVID. A delayed announcement came out about the death of a healthy unvaccinated child between the age of 10 to 17. Was that an isolated case and issue? What is the status in Houston and Harris County for 0 to 14 years old? It says a delayed announcement. Could you kind of speak a little bit to the process we have to go through for confirmation?
Yeah, so I'll do that because that was a City of Houston case, and then I'll let Dr. White talk about the overall situation with children. So with that case, in order for us to report a case, there are two major elements. One is the physician has to indicate that COVID was a contributory factor in the child's death. And then the other part of the investigation goes into, determining whether or not what the social circumstances were, and where the child got infected, and it's called case investigation, and that can take a long time in some cases. And so this is why you may remember that we've had it all along, but it was a lot of attention paid in the beginning, that sometimes we were reporting deaths 3 months after they occurred. And that has to do not so much with the doctor has a 10-day window to report their part of the death certificate. The other part, there's no limit on that. And so those case investigations can sometimes be very complicated and very time taking.
And then likewise for the county, we follow that same sort of structure as well. And it does take time to get that information reported out. Currently, the county is really following right now our pediatric hospitalizations. And so when we look at some of the data that's for our region, we're seeing a more uptick in pediatric hospitalizations. Unfortunately, the one death that the city did report. And so that's something that we're mindful of as providers and healthcare stewards, is paying attention to what's happening with our kids and kids' health. So right now, our children's hospitals are seeing a few more kids hospitalized with COVID. And so this is a great question to bring to light the importance of, our mitigation and safety efforts around our children, especially those who can't be vaccinated.
Texas public school COVID cases were up over 9,000 in 1 week. Are all schools required to report, or are local schools doing any better than the state?
We have a school, we call a school investigation team. And so our teams, working along with school leadership and our epidemiologists, do get information reported to us. And then what we're able to support schools is if they see concerns, numbers are increasing, what resources can the county and the city offer them to help with sort of improving their risk. So schools in our region I would say are doing well. They're partnering with us well, and they're trying to put all those safety measures in place to make sure kids are safe at school.
William Schaefer at Vanderbilt said children are a distribution franchise for influenza. Are kids spreading COVID faster and longer than adults?
So I'll take that. So yeah, I mean, kids just do their natural, behavior. And when you take a large number of people and you put them into a small place like a school, whether you're adults or kids, it doesn't matter. That's exactly what the virus is. Any virus will take advantage of in spreading itself across the community. We see this every year. Anybody who's been a parent knows that once the school season starts in the fall, that's when the runny noses and the sniffles start as well. It's not the kid's fault. It's just the way viruses take advantage of our behaviors. And so we're seeing that currently now with the COVID. In fact, there's been a couple of reports when you look at even just with the masking. And school districts where kids are wearing masks are seeing a much smaller increase in cases than the schools that are not having masking. But pointing out that even the schools that have mask mandates, we're still seeing spread within those. It's just a fraction of what we're seeing in the school systems without masks.
Seems like we're reinforcing the same messages. Ask up. We typically look at Southern Hemisphere countries such as Australia to see how our flu season will be. What are we seeing?
So I will partially take that. Great question. I think it's still early right now to kind of put a lens on kind of what's happening in Australia. So that's a great question. And our teams, both the city and the county have teams that follow the flu surveillance. It's a flu surveillance group. What we will say is we are about to head into flu season. So knowing that, we're about to also add efforts to ensure that our community understands what the importance means to get a flu vaccine, and that as we start heading into September and October, we're going to strongly encourage everyone to get their flu vaccination.
So let me say one thing on that. So we can look to the Southern Hemisphere, as we usually do, to see what, in fact, the people make the vaccines, try to get samples of the virus so they can make the new thing. But with this, the thing which is changing it is that in the Southern Hemisphere, depending on what country you look at, they may or may not be wearing a lot of masks. And we saw last time around, when a lot of masks were being worn, it nearly eliminated the flu. So it almost doesn't matter what we're seeing in the Southern Hemisphere. What's going to matter is whether or not we wear masks and social distance here in the United States to predict what kind of a flu season we're going to have.
Yeah, good point.
One more flu question. It's almost time for flu shots. Should we alter the time to get one earlier or later?
So I would say no. I would go ahead, get it early. My only advice, and this is based on zero science whatsoever, just if you're going to get a booster shot, I probably wouldn't get the flu shot and the booster shot on the same day, because they're going to give you similar symptoms of a sore arm and body aches and stuff. And so I would probably recommend that you separate those by a couple weeks.
Okay, David, you anticipated the next question. Can we receive both the COVID third shot or first for some, along with the flu shot, or will that impact each other in any way? Now, you didn't say that they would impact each other. You talked about the reactions to it.
Yeah. So again, I'm not a laboratory virologist. I don't imagine that they would interfere with each other, but I think that you'll feel more lousy. Dr. White, what do you think?
Yeah, CDC gave guidance on co-administration of COVID vaccine with other routine vaccines, and they were really saying, given the history that we've seen, it should not be a barrier. But to your point, often in practices, we'll say do one, go through those symptoms, not maybe feeling pukey for a few days, and then you go back and get your next boost, get your next vaccine. So I can see where someone gets the COVID, finishes the series, and then a couple weeks later gets their flu vaccine.
I'm gonna take mine at the same time.
Different arm. Same
Get
time.
it over.
Yeah.
Get it over with. Probably not. I take them from different providers. Do adenovirus vaccines drop in effectiveness as quickly as other vaccines?
Again, I think Dr. Purse said earlier, like a virologist, I can't speak to that question to really know how to best answer it. I don't even know if we have enough information right now with COVID. We're still learning more. So great question, but I personally don't have enough information to give that listener or viewer an answer, a scientific answer.
And David is shaking his head no too, so he doesn't have the answer to that either. We'll wait and see.
Yeah.
I'm sure somebody's researching it, Pfizer CEO said it was likely that a vaccine-resistant strain of COVID will emerge. How likely do scientists believe that to be?
Well, I can't speak for scientists as a whole, but I will, so the Dr. Downer in me, and we often sort of joke internally that, there's Dr. Person, there's Dr. Downer. I think it's highly likely. If you just think about the theory of natural selection, which the coronavirus has basically followed all along here, that when we look at the planet, here in the United States, we've got about half the population is vaccinated, but half isn't. So in anyone who becomes infected and they start making copies, they're making millions and millions of copies. And every time you make a copy, you run the chance that there'll be a mutation. In fact, we know that because it's an RNA strand, there are plenty of mutations that occur. Most of them just don't make any difference. The 99.9% of them make no difference whatsoever. So we never ever, learn about it. But in that tiny percent that does make a difference and gives the the strain a survival advantage, it will take off. Now, here in the United States, we're almost in the worst situation of all, because now you got half the population creating all these different variants, just waiting for one. And now next to them, you got the test population of people who are vaccinated to find out whether or not this mutation can spread amongst that group of folks that are vaccinated. So we're almost in the worst situation of all. But when we look at globally, I think it's a matter of time before we have a variant that is able to get around the vaccine. And that's just Dr. Downer, and I apologize, but I think that's the truth. That's what I fear.
Anything to add, Dr. White?
No, I think he said it perfectly.
I'll start calling him Dr. Downer then. Japan halted 1.6 million doses of Moderna over contamination worries. How does the U.S. prevent this for their deliveries? Do we know that? Go ahead.
I was going to say, because I think in the Japan group, they got their shipment from Spain. We have not received shipments from Spain, so we don't have that allotment. But I know we have safety measures here in the States, FDA and others, that ensure that if there's a concern, I think we've seen it before, they do a pause, they go back and do a review, and they have significant pharmaceutical safety measures in place.
Yeah, let me add one thing so Dr. White's exactly right. But the other thing is we talk about these vaccines getting the emergency use authorizations, and then later on they get full authorization. The difference between the two has nothing to do with the efficacy of the virus, or the vaccine rather. That is what got it the emergency use authorization, that we know that it's effective. The full authorization actually goes to the really rigorous inspection of the production process to make sure there won't be contaminations. So while people are waiting I want to wait for full authorization to make sure it works. No, that question was answered. That's how it got the emergency use authorization. The part's going on now is making sure the supply chain is rigorously done so that we don't get contaminants.
Great clarification. A study in Belgium just reported Moderna vaccination generated double the antibodies as Pfizer. Are y'all familiar with that?
I've heard of it, but I know one of the considerations people, when they talk about antibodies, is that you're presuming that if you measure antibodies, that's going to let you know if you are fully protected. And what we're saying is science is not telling us that antibodies is the benchmark that we should be looking at, because we have way more considerations. T cells, B cells are, NK cells. There's so many other cells outside of just saying antibody numbers to give you a false sense that you have a protection. So I think science is still helping us understand that really probably isn't the benchmark right now.
Moderna's CEO said, except for Delta, there will be protection potentially for a couple of years with their vaccine. Is this a corporate wish or based on science? Good question.
First, you answered that earlier, because that's to your point about the virus is wanting to survive and not and replicate. And if half of us are vaccinated and half of us aren't, right, it puts it right in the middle where that virus can try to, change itself so that it's not going to be viable. It'll overdo or overcome the vaccinated individuals. So yeah, is the CEO optimistic? Sure. But if we don't get enough people vaccinated, the virus is going to do what it wants to do, which is mutate and sort of navigate around vaccinated people and get more people ill.
Ironically, the corporation probably actually wishes that it wouldn't last for years so they could sell more of it. So
okay, Dr. Downer.
Could have never said that.
I don't know whether that's Downer or whatever, I guess the key point to what Dr. White's statement is that, we can influence the outcome of this. We really do need to get vaccinated. When will Moderna receive full approval?
Moderna submitted their paperwork about a month after Pfizer, so I would expect it to be pretty soon now. That's what I would expect.
It was late August, so hopefully.
Well, perhaps too soon to get anecdotal information, but for those getting a third shot, what is the expected improvement goal?
We're just the thought is that if you had any waning in your immune system, that extra booster is going to push your response up higher and higher so that you have additional coverage.
An antibody test showed mine to be really low. Will a third shot be like receiving a first or second in terms of reactions?
So, yeah, we talked about this a little bit earlier. What I'm hearing anecdotally is that most folks with their booster shot who are having a reaction, or it's similar to what they had after their second shot, or maybe a little bit less. I've not heard of many people at all. In fact, I have not heard of anyone at all who's had a worse reaction, but a lot of it is pretty similar. But, the other thing is to keep in mind, and Dr. White touched on this earlier, immunology is really complicated. And so we talk a lot about antibody levels, and with the third shot and with people who have been vaccinated for, 8 months, a year, the other thing we need to start paying attention to is that the amount of antibodies in your system is going to drop off. That doesn't mean that your immunity has changed. If you consider the fact that throughout your life, you're exposed to millions and millions of viruses and bacteria, and you produce antibodies to all of those at some point, the number of antibodies in your system decrease. You develop the memory cells in your bone marrow that can be quickly reactivated. If you had high levels of antibody in your blood for everything you've ever been exposed to, there would be no room left for the red blood cells. So this gets really complicated, and we need to, at this point, I think the public needs to come to learn about the idea of the memory cells and stop focusing so much on the antibody levels.
Okay, I'll start calling you Dr. Purse again after that. I got the Moderna shot initially. Should I get a Pfizer for my third dose?
Again, this is a difficult question because if the person's asking about third dose consideration, which is what we're doing right now for third doses, it's really for those immunocompromised individuals, then third dosing, you should get what you received as your initial series. However, CDC did give guidance if you don't have access to that third option, the option that you have for your first two, because both vaccines are mRNAs, then there is guidance that there's the option to do the mRNA. But what the best practice right now is trying to stay with the initial vaccine that you received, and your third dose consideration vaccination shot, third dose, should be that same one.
Related question. Another ask. I received J&J. Should I get a third shot of Pfizer or 2 more shots?
Yeah, so I'll take that one. So, this is part of the guidance that we're hoping will come out with the FDA in terms of boosters overall, because while J&J has looked at subsequent doses, for them it would be a second dose. I don't think that we have the answer on that yet. And so I'm really hoping that when the FDA comes out with the guidance on the boosters, that they answer that particular question.
Okay, I'm going to go a little fast. An expert doctor on TV mentioned that given the shots so close together that was pushed because of the emergency need may have impacted the waning effectiveness. For those who have not been vaccinated, will we be better moving forward to extend the time in between?
I mean, this is one of those, they're studying those type of questions. I think in vaccine communities, that's one of sort of the Hep B, it's 1 month, and then you wait about 6 months. So they're kind of taking from previous playbooks. But again, to that person, we're still learning more information about that.
Are there multiple protocols for in-hospital treatment? If so, what is the most effective?
So in hospital, every patient gets treated based on what their symptoms are. So there are protocols, particularly around things like, monoclonal antibodies. And so those are pretty standard from one hospital to the next. But that doesn't mean that one patient to the next will be treated exactly the same.
The ICU bed situation is frightening. Where the emergency response is occurring, are monetary incentives to attract medical personnel working?
So I'll take that one. So yeah, the ICU situation is frightening. The Texas Medical Center actually reports they're well into they're about halfway into their phase 1 expansion. And the rate limiting step is nurses, but it's not just ICU nurses, it's nurses at all levels. And so the monitoring incentives are working in that nurses are responding to those and going and taking jobs. The problem is that very often it's a working nurse who leaves where she's working, he or she is working now, to go take a job that's higher paid to go work someplace else. So in the end, what we really need to do is be attracting nurses who have recently retired, those that are, we're not working in hospital settings but have that skill set. But while we're just moving them from one hospital to the next, that's probably not the most efficient way to do it.
You'll love this one. I heard a doctor at a meeting this past week say, just take zinc and let it work with your natural immunities. Take your mask off.
So we'll arm wrestle over who answers this one. I answer the last one, Dr.
I'm
White. You
not
go
gonna
ahead.
let you take
Yeah.
long. You don't like that, right?
We don't like that, no.
All right, next question. COVID reporting in some states appear to suffer from a lack of transparency. Their numbers make it appear that the virus is declining even in high congestion areas like prisons. Are you confident that Texas provide accurate data, both positive and negative?
Go ahead, Dr. Well, we were obligated to report. So as we get these results in, we are stewards in making sure that information gets to the proper channels. So from a health department, we are obligated to do reporting.
And sometimes reporting lags. Months ago, I heard about a heroes recovery cohort. It appeared first responders would be looked at to determine the vaccine effectiveness. What became of this review? Are you familiar with it?
I'm not.
Yeah, it's I think it was an early MMWR, but we can certainly follow back up. I don't know the exact conclusion from that study yet.
Okay. Texas Poison Control reported a 550% increase in calls from people taking ivermectin. Unfortunate. Because we have been isolating for so many months, we should have a bad winter cold season. I think you made reference to that. I think you said that wearing masks would probably influence that, right?
Yeah, to make it better.
All right. The number one problem right now is staffing and not COVID. Your response to that?
No, the problem is COVID.
Yeah.
It's not mixed.
University of California, San Diego led a study that shows COVID-19 is not a respiratory illness, but rather a vascular disease.
So the virus does get into endothelial structure, endothelial cells, which line our vascular system. So that is correct. It has a vascular component. However, we know it gets in through the respiratory system. It gets in through our nasal passages. So it's a little bit of both.
This virus attacks everything.
Yeah, everything.
Oregano oil helps with breathing once you have COVID.
Vaccination helps before you get COVID.
It appears as if a lot of people are, reading from different sources and coming up with their own conclusions. In one sentence, what would your advice be to those folks?
We really want people to pay attention to what the science is showing them, and the health departments are great resources. Both City of Houston and Harris County Health Department have great resources, and they should reach out if they want actual information that's scientifically looked at and reviewed, and that's what we're here as a resource for the community.
Dr. Downer David Purse.
Yeah, so I just echo what Dr. White said. I don't know what it's going to take for people to understand that from a public health standpoint, we got no dog in the fight of blowing this up and making this into something that it isn't. The virus is out there. Dr. White and I have both had the unfortunate experience of being able to see somebody who has suffered greatly and they die. And it's real, it's preventable, and you got to protect your family and forget about the politics. For the love of God, forget about the politics and do what it takes to take care of your family and protect yourself.
Thank you for joining us with COVID-19 Talks with Local Health Authorities. With us is Dr. Janita White, representing Harris County, Dr. David Purse, representing the City of Houston. Special thanks to past President Kathy Finninger of Rotary Club of Houston. Thank you, producer Morgan Ash. I'm Stephen Williams, the Director of the Houston Health Department.